We begin with the state of Michigan and the pause on the use of the Johnson & Johnson coronavirus vaccine as our COVID cases continue to spike. The governor's been telling us that vaccines are the way out. The CDC and the FDA have told doctors and nurses to stop giving the one-shot coronavirus vaccine.
Nearly 7 million doses of the vaccine have been given, but in the U.S., 6 cases have been detected of a very uncommon type of blood clot. It's a tiny number, but a massive impact. We're covering what this means for those waiting for the vaccine and what it means for the governor's plan.
First, let's start with Local 4's medical doctor, Frank McGeorge. Doc, it's not a big number, but apparently enough concern to pump the brakes.
Yeah, Devin, it is. So the specific blood clot is called a cerebral venous sinus thrombosis. And that's basically a clot in a vein that drains blood from a person's brain. Now, that can lead to increased pressure in the skull and even bleeding. That condition is very rare by itself, but the question with regard to the Johnson & Johnson vaccine is even more rare because it's also happening in the setting of low platelets. So far, there have been 6 cases in the U.S., all in women between 18 and 48 years old and occurring between 6 and 13 days after receiving the vaccine. 1 patient has died and 1 is in critical condition. The recommended pause in administration of the Johnson & Johnson vaccine was issued out of an abundance of caution when the concern was recognized. There's heightened attention to potential clotting problems with the Johnson & Johnson vaccine due to similarities it shares with the AstraZeneca vaccine, which has undergone extra scrutiny in other countries due to blood clots.
We don't have a definitive cause, but the probable cause that we believe may be involved here that we can speculate is an immune response that occurs very, very rarely after some people receive the vaccine, and that immune response leads to activation of the platelets and these extremely rare blood clots.
For people who got the vaccine more than a month ago, the risk to them is very low at this time. For people who recently got the vaccine within the last couple weeks, they should be aware to look for any symptoms. If you've received the vaccine and developed severe headache, abdominal pain, leg pain, or shortness of breath, you should contact your healthcare provider and seek medical treatment.
Now, tomorrow, the CDC Advisory Committee on Immunization Practices is going to meet to discuss the issue and hopefully provide further guidance. Meanwhile, the FDA really wants to get the word out to healthcare providers that this particular condition should not be treated in the usual way with the blood thinner heparin because that could worsen the condition.
So any indication, do we understand yet exactly how long this pause on the vaccine is going to last, or can we know?
Well, unfortunately, we can't know at this point. We don't know precisely. It could end up being just a matter of days, we hope, while they basically work on guidance for what to watch for and how to treat this condition, as well as really possibly narrowing the groups that are best suited to receive this vaccine. But I do really want to emphasize this issue is specific only to the Johnson & Johnson single-shot vaccine. The Pfizer and Moderna 2-dose mRNA vaccines have not had any similar concerns raised.
So important to note. All right, Doc, we'll keep you close by.